Hi, so I'm Yara Safi, and I am the International Account Director for In Touch with Health and Synopsis, which are part of the wider Viter group. And we're also lucky today to have Kieran presenting two further product sets in the next talk. So it's a real pleasure to be here today. In Touch with Health and Synopsis are focused on putting the right patient in the right place at the right time. And I chose to talk to you today about Synopsis due to the immense relevance it is having in the current climate. Next slide, please. So Synopsis enables the efficient management of surgery waiting lists and backlogs, which are unfortunately growing day by day due to the COVID-19, helping to reduce unmet surgery needs. And the most important thing about Synopsis is it helps you save time, save money, and saves life. Next one, please. So with the save time, we can save time because if we use an app to pre-fill for the patient to fill the questionnaire from home, then the patient does not have to attend it to our hospital appointment. Saves money. Next, please. Next. If we can prevent 10 theater cancellations a week, that would equate to 1.5 million saving a year in pounds in a UK hospital, which is 17 million NOK. And if we save lives, which is the most important thing, is because that Synopsis, next, please. It's because Synopsis was created by and developed by anesthesiologists who saw the need for it, and it is based on 250 algorithms and risk scores, which highlight all the risks, ensuring that things are not missed. Next one, please. So Synopsis is made of two platforms. One is Synopsis Home, which really enables the patient to fill, as I said before, the questionnaire from home. Next one, please. Whereas Synopsis IQ is the clinical platform that enables the clinical staff to have a fully digital and comprehensive preoperative record for each patient. So we know that surgery is the engine room of the hospital. And if it is so, then pre-op is the fuel of the engine. Hence, even if we have the smallest of improvements that we can do through these tools, then we can have a real efficiency gain. So let's look in the next slide, please, on outcomes from our customers. Next, please. So we have one customer, which is English, someone, Worcester Hospital, which really launched Synopsis Home during COVID. And just in 3 months' time, they were able to make 21% reduction of hospital activity time per assessment. So the patients do not have to attend the hospital, the nurses do not have to spend unnecessary time on assessments, and hence they can really focus on the complex patients to give better care to the patient. Next, please. And the next one, just go through the animations, thank you. So that is really just a very quick look on how do we save time and what we do with that. Next one, please. So on the saving the money, which is very important, we start with the eliminating the process of paper, which is we take away all the storage or the printing. We reduce transportation costs for the patient, but also and most importantly, we can identify very quickly the patients to fill theater lists, and we reduce cancellation. Next, please. And the next and the next. We have to, yeah, perfect. Great. So one of our hospitals was able to really cancel, like really have zero cancellation on the day of surgery using our tools in the initial 4 months. And they managed to get a return on invest in the first 10 days from launch. Next one. I would like to spend a little bit more time on this slide, which is saves lives, because at the end of the day, this is the most important thing. And as I said before, Synopsis was really developed by an anesthesiologist and is really based on 250 clinically validated algorithm, one of which maybe everyone knows, which is the ASA scores. But also, it is a registered medical device, so really nothing is missed, and the captured data enables you to have optimal reports and performance analysis and improvements. We also have a categorized traffic light system. So really on one view, you can really know which patients are at risks and which patients have really good health and can have a surgery without any problem. So we reduce the volume of patients inside of the hospital, and this is now, again, more important than ever because we improve infection prevention, social distancing. Next, please. 2 animations here, I think. Yeah, and the next one. Perfect. So just to mention that we have 64% of the pre-op patients using Synopsis from home that completed the questionnaire at home, as I mentioned. Perfect. The last 2 minutes, please, on the demo. So I have a demo for you to show you the, can we make a play on the video, please? Video, play. Or great. Oh, no. Again. Yeah. The animation should start. It's a video that should show you very good. So this is Synopsis Home. So you register, you agree to the terms and register as a patient. Then you fill in your details, and it just shows you that you go through preoperative questions that are very intuitive. It's a yes, no. You enter your details, and all is clear. Then you get a summary of it. You can review your answers. You can also edit them and save them. So once that is saved and shared with your hospital that is responsible for your surgery, that gets translated into Synopsis IQ, which shows you really all the history and all the questions that the patient has answered. You have several tabs, so all the information is really placed perfectly. And of course, the summary of all of this is the risk assessment, where you have the clinical overview, you have the clinical details, and as I said, it's an estimated ASA score that can be overridden by the relevant person working on it. So to summarize and finish, yeah, thank you. Perfect. So to summarize and finish with it, Synopsis enables you to efficiently transform perioperative pathways, starting the preoperative assessment process outside of the hospital, reducing the unnecessary visits to the hospital, and supporting the optimization of the patient throughput and theater time alongside a reduction in cancellation rates. Thank you very much for your attention.